So for part 2 of the skeletal system, we're going to dive into the different bones that we see in the skeleton and talk about how we can divide the skeleton into two main parts or two main regions. We have the axial and the appendicular skeletons. Now we covered this a little bit in the lab video, so we'll go over it a little bit here as well. Everything you see here in blue is axial. And everything you see here in beige along the limbs is appendicular. Right? And so same thing here, if you're looking at the names of different bones, right, if they're highlighted in this blue color, then they are axial bones, and if they do not have any sort of highlighting, then they are appendicular bones. And so what you see here is the main way to divide the skeleton is, are you along the center or are you on a limb? So if you're along the center, the bones of the skull, the bones of the rib cage, right, the bones of the vertebral column, these are all along that center line. If you took a line and divided it down from the top of your head, between your eyes, all the way down, bones that are coming along that line are going to be axial. And then anything involving the limbs, the shoulder, the arms, the hips, the legs, these are all appendicular. Think appendage, right? Appendage is a limb. And so anything that has to do with an appendage will be appendicular. But do keep in mind that there are some bones that fall along the middle part of the body, or that kind of creep in towards the middle part of the body, that are appendicular. So if we look in the front here, we see the clavicle or the collarbone. That does come forward towards the midline. However, it is part of the shoulder, and so we call that an appendicular bone. Same thing, we see the bones that make up the hips, the pelvic girdle. For the most part, these bones are appendicular. And then if we move our way back up to the shoulder, we see the scapula, the shoulder blade. Again, it creeps in towards the middle. However, it is part of the shoulder joint, and so that would be appendicular. Right? So for the most part, these bones are pretty easy to tell apart in terms of which division of the skeleton they belong to, but there are those ones that are kind of on the edge there that you'll want to pay attention to. So we'll start with the axial skeleton and talk about some of the various bones and the specific bones we find in the axial skeleton. Right? When we look at the skull, now the skull is actually multiple bones all fused or working together to form what we call the cranium, which is going to be the bones, the space that holds your brain, and the facial bones, the bones that make up your face. We also include in the axial skeleton the hyoid bone, the vertebral column, which will be all of the vertebra and those intervertebral discs, and then the rib cage, the ribs and the sternum. So let's look at the cranium first. The cranium and the bones that make up the cranium together are going to help protect your brain. Think of it like your own natural helmet. We have 8 different bones that are going to be forming that. And some of those bones have these openings, these spaces that we call sinuses. But let's look at some of the ones that we care about. So I've highlighted some of them because not every bone labeled here is part of the cranium. Some of them are part of the facial bones. So we're going to point out just a few. The parietal bone is this bone here we see in blue. The frontal bone forms part of the forehead. The occipital bone is back here, covering the back of the head. The temporal bone here in yellow with some kind of interesting features. The sphenoid bone right here. And the ethmoid bone, which you can kind of see right here. You can't see it from the posterior view, from the view from the bottom. We see it just ever so slightly here because it's kind of deeper inside of the skull, deeper inside your head. And so all these bones that I have boxed in here are contributing to protecting your brain. They're all forming that case, that helmet surrounding your brain. And so you'll want to be familiar with those, and you'll want to be able to identify them on an image. The facial bones, as well as the hyoid bone, the facial bones are going to make up the structures of your face. And so we have the mandible. That's going to be your jaw, the lower portion of your jaw. That's actually the only bone in your skull that can freely move. The maxillae, which are kind of opposite to the mandible. So if the mandible holds your bottom teeth, your maxillae hold your upper teeth. The zygomatic bones, which form your cheekbones, and then the nasal bones, which are going to form the upper portion of your nose, with the remaining bit of your nose being cartilage. These are not all the facial bones, but these are some that you should be able to point out. The hyoid bone is not actually part of the skull. The hyoid bone's a little different. It's actually very unique compared to all the other bones, in that the hyoid is the only bone you have that does not articulate, meaning it does not connect with another bone. It's free on its own. It is attached to things via ligaments and, or not via ligaments, but via cartilages, via muscles and whatnot, tendons, but it's not connecting to another bone. And this is also one of those bones you may have heard of if you're into crime shows, CSI, things like that. Then you may have heard of, you know, when they find some victim that's been strangled and you see them say, the hyoid bone has been broken. It's actually a really hard bone to break because it doesn't articulate because of where it's located. And so that's actually a common thing, is that if someone does get attacked and strangled, that bone would break. And that's a very key identifier that something has gone really wrong for a person. So let's look at the facial bones now on an image. And again, we can see some of the cranial bones here as well. We see the frontal bone from making up your forehead, the temporal bone forming the sides of your head. But then let's look at some of these facial bones. We have the zygomatic bone, which is forming your cheek, the nasal bone, which is forming the upper kind of part of your nose, the mandible forming the jaw, and then the maxilla forming the area where your upper teeth would root in. And so these are the main bones, not all, but the main bones that are contributing to your face. And then here's where we see the hyoid. Again, it's nearby with the larynx. Again, it does not articulate with a different bone. It's going to connect with things like muscle and other connective tissues, but not bone. As we make our way down from the skull, we get to the vertebral column. And in your vertebral column, in your neck and your back, you have 33 vertebrae. And we can break those vertebrae into different regions. Cervical, which will be found in the neck. Thoracic, which will be found in the chest. Lumbar, which will be found in the lower back. And then the sacrum and the coccyx, which will form part of your pelvic girdle. So of the cervical vertebrae, you have 7. So 7 vertebrae found in your neck. Thoracic, we have 12. You also have 12 pairs of ribs. So you can kind of match them up, that for every thoracic vertebra you have a pair of ribs. The lumbar region, you have 5 vertebrae. And then the sacrum, you have 5 fused vertebrae. They're all stuck together. Same with the coccyx, or also known as your tailbone. These are also fused together. The cervical, the thoracic, and the lumbar are not fused. They have movement between them, right? And we see that movement, we see the ability for them to move in those intervertebral discs, right? That's going to allow for some movement. Not a ton, but enough. So those intervertebral discs we see are also going to be made of fibrocartilage, like we said in the last video. If you look at each region, you'll notice that they look differently. Right, here's the cervical vertebra up in the neck. Right, they look different from the 12 we find in the thoracic region. Right, in the thoracic region, we have all these facets for ribs to attach to. We don't see that in the cervical region. When we get down to the lumbar region, we notice that we've gotten a lot larger. And we've also seen that we don't have these bits sticking down, they're sticking more out and they're smaller and fatter. And then the sacrum and the coccyx, they're extremely different looking because everything is fused together for those ones. So you'll want to be able to identify those different regions and be able to say which region is which. With the ribs, their primary goal is to protect the heart and lungs, right? We're basically forming a bony cage around these important organs. These are flat bones, so they don't have the same structure as the long bone that we talked about earlier. We're not going to get into flat bone structure, but just keep it in mind. And each pair of ribs are going to articulate with one of those thoracic vertebrae. Because remember, we have 12 vertebrae in the thoracic region and 12 pairs of ribs. 7 of those pairs are going to be what we call true ribs. And when we say true ribs, we mean that the ribs are going to directly articulate, they're going to directly connect with the sternum, which is the breastbone. The 3 pairs that come after those 7, we call the false ribs. And the false ribs are called that because they don't directly articulate, they don't directly connect to the sternum. Those ribs actually connect to another pair of ribs. And then we get to the last 2 pairs, which do fall under the false rib category, but they're a little bit more specialized in that they're the floating ribs. They don't articulate. They don't connect with the sternum at all. So if we look at this, right, so here are those vertebrae. Right, we see like they have this nice little body, and then what we call the spinous process sticking out. Right, so this would be kind of a typical vertebra. But let's look at those ribs. So here is the sternum, or the breastbone, and then here are all the rib pairs numbered. And so we look at the first 7 here, and we look at where they connect. They're connecting directly with that sternum, right? We look at pair 4 here. We go wrap around, we come forward, bam, we connect right to the sternum. If we look at the false ribs, which will be the remaining pairs, including the floating ribs, we see that we don't connect directly to the sternum. We actually have to connect to another pair of ribs that's a level higher before we actually get to connect to that sternum. So that's the difference between the true and the false ribs. Do you remember that the floating ribs, pairs 11 and 12, they are still considered false ribs, but they don't articulate with anybody, or they don't articulate with the sternum at all. They free float. So they connect to the vertebra, but not to anything else. As we move to the limbs, we're getting to the appendicular skeleton, and we can break this down into 2 regions: the pectoral girdle in the upper limb, or the arms, and the pelvic girdle in the lower limb, or the legs. So let's look at the upper limb first. Let's look at the arm. The pectoral girdle is the shoulder, and there are 2 bones that we care about in this area: the scapula and the clavicle. You might know these bones better as your shoulder blade and your collarbone. So your pectoral girdle is composed of your scapula and your clavicle. As we go down into the limb, into the arm, I want to point out first that we have this pattern, because we're going to see this pattern in the leg as well, of the upper part of the limb has 1 bone, the lower part of the limb has 2 bones, and then we have a lot of bones at the very end. So we're following this pattern. In the upper part of the arm, we have the humerus. As we get to the forearm, we have the radius and ulna. And then we get into the wrist and the hand, we have the carpals, which is a group of bones forming your wrist, the metacarpals, which are the bones forming the palm of your hand, and then the phalanges, which are forming your fingers. Now, in later classes, you'll have to know the individual carpal bones. We're not going to worry about that in here. Just know the classification. Just know the grouping as a whole. So, humerus in the upper arm, radius and ulna in the forearm, carpals in the wrist, and then metacarpals and phalanges in the hand. As we move down into the leg and the hip area, we have the pelvic girdle, which is composed of coxal bones. This can be broken down into some other regions, the ilium, the pubis, and the ischium. However, I will use coxal bone for the sake of an exam. And then we see the same pattern in the lower limb. We see the 1 bone in the upper part, 2 bones in the lower part, and then lots of bones at the very end. One small exception. When we get to the knee, we have 1 extra piece that we did not see in the arm, and that's the kneecap. right? There's no elbow cap, so you don't have to worry about remembering an elbow cap because it does not exist. But let's start in the upper part of the limb, in the leg here, the thigh. And in the thigh, we find the femur. This is one of the strongest bones that you actually have, the femur. We move down to the knee joint. We see the kneecap, also known as the patella. And then we get to the lower limb, the lower leg. We have the tibia and the fibula. The tibia is going to be the bone that's going to be bearing all of your weight in the bottom part of your leg. And it's also what's forming your shin. So when you accidentally, bump your leg into something and you're like, oh, my shin hurts, it's your tibia that you've hit. We get down to the ankle and we have the tarsals. So the tarsals are forming the ankle just like the carpals formed the wrist in the arm. The metatarsals and the phalanges are making up the foot. So same kind of pattern. Femur in the upper part of the leg, kneecap at the knee joint, that's something a little bit different. Lower leg has the tibia and fibula, 2 bones. Ankle is made up of the tarsals, and then the foot is the metatarsals and phalanges. So you notice phalanges we use twice, right? It's just a general term for the bones that we find in the digits, right? Your fingers and toes. Now, how do we connect these different bones together? Now, we talked a little bit about this earlier, and so let's get in a little more detail on this, of the different ways that bone can meet bone. Not every single joint is movable. Typically, when you think of a joint, you are thinking of a movable joint, but not every single one of them does move, and for good reason. So if you think about the skull, when we talked about the skull, we talked about the bones that make up your face and your cranium. You wouldn't want the bones holding your cranium together to move around. You'd want them to stay pretty rigid to protect your brain. And so in order to keep them stuck together and not moving, we have what we call a fibrous joint, like a suture. So the suture is the joint that keeps your occipital bone to your temporal bone or your parietal bone. Cartilaginous joints, these are joints that have a little bit more movement, but not a lot. So for example, the intervertebral discs between your vertebra, those are cartilaginous joints. And I know what you're probably thinking, you're like, well, I can bend my back a lot. I can bend forward, I can bend backwards, side to side. There's a lot of movement. What do you mean? When we say that there's not a lot of movement, we mean that an individual joint doesn't have much movement. So when you bend over, right, or you bend to the side and you have this large movement that you've made, it's because every single joint between your vertebra is helping a little bit. So one single vertebra or one single intervertebral disc is only going to provide a small amount. And any big movements you get with your back are because you have a bunch of these joints all working together. The joint that we're going to care about the most, though, is the synovial joint. The synovial joint is probably what you're thinking when you think of a joint. You think about your elbow, your shoulder, your knee. Those are synovial joints because synovial joints allow for a lot of free movement. So things like the ball and socket joint in your hips and your shoulder, or the hinge joint that you have in your knee and your elbow. Right? You can freely move those. You can kick your leg out. You can bring your knee to your chest. You can raise your arms up. All of these movements are available to you because these joints are synovial. So let's look at some of these. Now, there are multiple types of synovial joints. We're going to focus on 2 main ones, the ball and socket and the hinge joint. Now, we see this gymnast here doing something that I could only dream of being able to do. Maybe one day, not today. But if we look at how she's able to accomplish this, it's because of different types of joints. So let's look at the shoulder. We have the scapula, or the shoulder blade, and it has this kind of shallow little indentation, this kind of rounded out bowl-like structure. And then the humerus has this rounded out end. And so the rounded out end of the humerus fits very nicely into the bowl-like structure of the scapula. And that's going to allow for a very wide variety of movements. If you sit here and you move your arm around at the shoulder joint, you can kind of draw circles with your entire arm. You can move it up, you can move it down, you can bring your arm forward and across your chest, you can extend it back out to the side, you can spin it around, right, to some extent. A hinge joint is more limited than a ball and socket joint. So a hinge joint would be like your elbow. If you bend your arm at the elbow, you have two choices. You can bend your arm in, or you can extend your arm out. But you can't move your arm side to side at the elbow joint. You're locked in only one way or the other way. Kind of like a door, right? When you open a door or close a door, you can either pull it in one direction or push it in the other, and that's it. You can't open a door up or twist it around to open that door. Only two choices. When we look at some of the explanations of how we move about these joints, there's some terminology we do want to be familiar with. Flexion, extension, adduction, and abduction are just a few of these. Flexion is when we decrease the angle at the joint. So if we focus at the elbow again, when you have your arm straight out, your arm is extended. The joint angle across your elbow is 180 degrees, right? It's a straight line. If you were to bring your arm in and flex at the elbow, so you're bringing your hand towards your head, that elbow joint has now gotten smaller. I should say the angle has gotten smaller. So instead of it being 180 degrees as a flat line, you've brought it in, and if you have your arm straight up, then you have a 90-degree angle. So that's flexion. Adduction and abduction. Those are how we describe movements towards or away from the midline. So if you were to draw a line down the middle of your body, from the top of your head, between your eyes, all the way down, dividing your body into a left and right side. Adduction, ADD. Adduction, you're moving your body part in towards your midline. So if you have your arm out to the side and you move it in towards the middle of your body, that would be adduction. Abduction, ABD. Abduction, we're moving a body part away from the midline. So if you have your arms at your sides and then you move your arm out in a way to stretch your arms out side to side, you have abducted your arms away from the midline. So I like to think of it as if aliens came down and abducted you, right, to space, they would take you away from Earth. So you can think of that as a way to maybe remember that. Rotation is when we move a body part around its own axis. So if you were to stick your arm straight out in front of you, and you were to have a pencil against a wall, and you were to draw a single dot just by moving your arm around in an itty bitty teeny tiny circle around a single point, that would be rotation. Because you're not drawing a big old circle, you're just making a point on the wall. Circumduction is similar to that, except we're outlining a cone shape. So this would be like if you had your arm stretched out in front of you with a pencil or a pen against a wall, and you drew a big old circle just by moving your arm around. That would be circumduction. Supination and pronation, we're talking about how the hands are facing. So supination, the palms of your hands are facing forward, they're anterior. Pronation, your hands are facing posterior, or your palms of your hands are facing back behind you. Inversion and eversion are kind of similar to supination and pronation, except we're talking about the feet. So inversion, this would be like if you rolled onto the outer portions of your foot so that the soles of your feet could look at each other. That would be inversion. And eversion is if you were to roll onto the inner part of your foot so that the soles of your feet, the bottoms of your feet, were facing away from each other. I do talk about these again in the lab video, so if you want to go over them in a little more detail, then you can look there.